How do MRI, CORT, and PET scans diagnose bone cancer? Imagine trying to find a tiny problem inside a complex structure. That's what doctors do when they look for bone cancer. They relying on advanced imaging tests like MRI, CORT, and PET scans to get a clear picture of what's happening inside the body. These scans are essential tools that help identify, evaluate, and plan treatment for bone tumors. Each one offers unique insights, and they often work together to give a complete understanding. Magnetic resonance imaging, or MRI, uses strong magnetic fields and radio waves to produce highly detailed images of bones and the soft tissues around them. Because MRI doesn't use radiation, it's especially good at detecting subtle changes in the bone marrow and nearby soft tissues. This makes it the go-to test for seeing the exact boundaries of a tumor and checking if it has spread to surrounding areas. MRI can reveal even small tumor extensions that might not be visible on other scans, helping doctors understand the full extent of the disease. Computed tomography, or CORT scans, use X-ray beams taken from multiple angles to create cross-sectional images of the body. These images give a clear view of the bone's structure, showing the size, shape, and location of a tumor. CORT scans are particularly useful for detecting bone destruction caused by cancer or new bone growth that occurs as the tumor develops. They are also valuable for checking if the cancer has spread to other parts of the body, like the lungs, which are common sites for metastasis. Because CORT provides detailed images of bone and lung tissue, it helps in staging the cancer and planning surgery or other treatments. Positron emission tomography, or PET scans, work differently. They use a small amount of radioactive material called a tracer that is injected into the bloodstream. Cancer cells have higher metabolic activity, so they absorb more of this tracer. PET scans detect where the tracer accumulates, highlighting areas of abnormal activity that could indicate cancer. When combined with CORT or MRI, PET scans give both the location and the activity level of the tumor. This combined imaging helps doctors see if the cancer has spread beyond the original site and how aggressive it might be. PET scans are especially useful for detecting early metastases and monitoring how well treatment is working. In practice, doctors often use these scans together. MRI provides detailed images of the local tumor and soft tissues, helping to define the tumor's exact boundaries. CORT scans give a clear picture of the bone's structure and help detect spread to the lungs or other bones. PET scans reveal the tumor's metabolic activity, which helps in identifying hidden metastases and understanding how aggressive the cancer may be. Combining these tests improves accuracy and helps in making the best treatment decisions. Before these scans, patients usually undergo initial tests if symptoms like pain, swelling, or fractures suggest a bone problem. The imaging results guide further steps, such as a biopsy, where a small tissue sample is taken for laboratory analysis. This confirms whether the tumor is benign or malignant. The entire process follows established medical guidelines to ensure accurate diagnosis and effective treatment planning. Remember, each person's situation is unique, and these imaging tests are part of a comprehensive approach to diagnosing bone cancer. Always consult healthcare professionals for personalized advice and treatment options. These scans are powerful tools that help doctors see inside the body clearly, leading to better outcomes and more targeted care.